Okay, welcome to everyone who's joined us this evening for an EVA Alumni Series talk with Nina Vollbehr. We're really happy to round out this first fall season of the series with Nina, and I'll introduce her briefly in just a minute. So as many of you know, we started this series this fall with the intention of showcasing some of the cutting-edge research that's come out of our European Varela Awards program. So each month, starting in September, we featured an alumna or an alumnus of the EVA program, and we've heard from them about their specific research outcomes related to their project, as well as their broader journey into the world of contemplative science. And so this has really been part of our broader efforts at MLE to disseminate the fruits of contemplative science to a wider audience, and also to create a sense of community for the next generation of contemplative science researchers. So this evening, Nina Vollbehr will be offering a talk entitled Yoga for Depression, Effects and Potential Working Mechanisms. So Nina Vollbehr is a psychologist at the Center for Integrative Psychiatry in Groningen. She works as a clinician as well as a PhD candidate at the University of Groningen. She holds a Master's of Science degree in clinical psychology from the University of Utrecht and is licensed as a registered mental health psychologist in the Netherlands. And she's also a 500-hour registered yoga teacher in addition. Her research focuses on yoga for chronic mood disorders and potential mechanisms such as rumination and self-compassion. She was awarded the Mind and Life Europe Varela Award in 2015 for her research on yoga for young women with depression. And so Nina will be sharing some of this research with us this evening. And after the talk, we're going to open up the room for questions. So if you do have questions, feel free to note them down, put them in the chat, or raise your hand when we're in the Q&A session. So thank you so much, Nina, for offering your time and sharing a little bit of your story with us this evening.
Well, thank you very much. Thank you very much for your kind introduction. And I will share my screen. Yeah, it's working. All right. Well, first of all, I'm very honored to be invited to give this talk, especially because Mind and Life Europe has been very important in the project that I will be presenting. First of all, it started with the generation of ideas. I did the European Summer Research Institute in 2015, and that really gave a start to our project and a start in developing the ideas. And then next we won the Varela Award, which was very important in actually conducting the research. And then now to have this opportunity to present our research for an audience of like-minded researchers. So thank you very much. Yeah, I was going to tell a little bit about me, but I don't think that's necessary anymore after this wonderful introduction. Yeah, I work both as a clinician and as a PhD candidate. So I try to combine the clinical work with the research, and I think that's also what you can see in our project. Well, a little bit about me. In this presentation, I was asked not just to share my research, but also to share a little bit about my journey, how it all came together, the research. So I started studying clinical psychology at the University of Groningen, and later my master's degree at the University of Utrecht. And while I was studying psychology, I already developed an interest into integrative psychology and also into contemplative practices. So while I was in college, I also started to practice yoga, and later I started to practice meditation. And then I intensively studied yoga when I was a volunteer in the Kripalu Center for Yoga and Health, which is in Massachusetts in America. So after that, kind of all my interests were bridged together. Because I started working at Lentis at the Center for Integrative Psychiatry. And this is a center that is dedicated to introduce more complementary and also contemplative practices into mental health care. for instance, mindfulness trainings or compassion trainings, and also yoga. And at the same time, we also started to collaborate with the University of Groningen, especially with Brian Ostapin. And then our research started to come together. And then next, I attended the European Summer School, which was on this beautiful island somewhere in the south of Germany. And this was really important for me because I was meeting so many like-minded researchers. I was meeting people who were having the same ideas about how do you design a study, how do you measure certain constructs. So it was all very important in how my research progressed. And then, of course, we were granted the Mind and Life Varela Award, and then later also a big funder in the Netherlands is ZonMW granted us a fund so we can actually conduct a large RCT. And this is the team that I have been working with over the past couple of years. And they're all very, very important into the work that we've done. So Brian Ostapin is my main mentor and collaborator, and also Rogier Hoenders from the Lentis Institute, and then Peter de Jong from the university, and also Mike Inauta from the university, and Casper Albers, who is a statistician. And then from Lentis, we have Agna Bartels Veldhuis and Stienke Kastelein. And then we also have Maya Spoevers, she is from the University Hospital, and Dennis Stant, who is involved as a cost effectiveness and analytics. So this is our team. All right, so I will be talking this evening about yoga and more specifically about working mechanisms of yoga. So in our project, we conducted many different studies that I will go over next. And in all these studies, we've looked at the effect of mindful yoga for people with depression. And then we especially focused on these working mechanisms. Important in this light is, I don't know how many yoga practitioners are in the audience, but maybe you know that there's many different forms of yoga. And the yoga that we refer to, we call it mindful yoga. And it's a form of yoga that is based on traditional hatha yoga. So it means that it consists of the physical postures of yoga. It also consists of breathing practices and meditation practices. And it's mindful yoga in a sense that the developing of a mindful awareness is very important in the type of yoga that we study. So it's not just the physical practice of yoga, but it's also developing this awareness of the moment with an accepting and compassionate attitude. Yeah, later I will go into more detail about the working mechanisms that we studied. But first, I present you the research that we have done so far. So what we did is we started with a meta-analysis of hatha yoga and to give an overview of the evidence that was there already for people with mood and anxiety disorders, and especially chronic mood and anxiety disorders. The next, we focused on the more preventive aspects of mindful yoga, and we did that in the form of a study with undergraduates, a lab study that was specifically designed to really also consider the working mechanisms. And also in our next study, that was important. So we did 2 studies with, again, undergraduates, and we studied the effects of a short mindful yoga intervention for undergraduate students. Then we started to work with the clinical population. We started with a pilot study. So we developed an intervention and then we studied it in our group of chronic mood and anxiety disorder patients. And after that, we also did a daily diary study in patients with chronic mood and anxiety disorders. Then we did a randomized controlled trial that was focused on young women with major depressive disorder. And from this trial, we did several other projects. So we did a cost effectiveness analysis. And we did a qualitative assessment of positive and negative experiences with the 9-week mindful yoga intervention. And finally, we're also working on a more theoretical, philosophical paper that gives an overview of the ethical issues that come with introducing yoga in mental health care. So since we only have until 7:30, I will not present all of these studies, but the green ones I will present later in more detail. What's also important, I think, to show here is that what you can see in the overview of our studies, that we use many different methods. And this is also based on something that really was introduced to me by Mind and Life, how you can get both a third person perspective, but also a first person perspective. So we also wanted to use more qualitative assessments, not only use questionnaires. So in our project, that has also been very important, as well as the last project where we work on the more ethical issues that come with introducing yoga. All right. So first, a little bit of background about depression. So depression has a very large impact on society. About 10 to 20% of people in the world ever get a depression. And current treatments are helpful, but unfortunately, many people do not recover, or they do not recover fully with the current treatment. And therefore, it is important to look at other treatments, or to look at what we did, additional treatments, in order to enhance the existing treatments for people with depression. So mindful yoga for depression is a more or less new treatment for depression. And it has some potential to actually work for people with depression. And that is because it is a combination of both exercise and, again, this mindfulness element. And we know from research that both exercise and mindfulness intervention have been effective for people with depression. So we figured maybe a combination of those can also work for people with depression. As I will show in our meta-analyses, we found that a lot of yoga research showed methodological shortcomings. So there is some evidence that yoga might reduce depression, but because of these methodological problems, more research is needed, and that's where our project started. So in order to develop effective treatments, it is oftentimes very important to look at the underlying mechanisms of a disorder. And this is what we try to do in our work. So not just find out, does yoga work, but also find out, why does it work? So what we did is we based our research on cognitive vulnerability models for depression. And in these cognitive vulnerability models, it's basically said that it starts with a state of negative affect, and people that are vulnerable for depression have all kind of negative biases and have all kind of emotion regulation strategies that are not very adaptive. So this leads to more negative affect, and then they come into some sort of loop in which they experience more and more and more negative affect. And then finally, it ends with depression. So we focused on these cognitive processes. There are certain biases or emotion regulation strategies that are important in this downward spiraling. So one of these mechanisms is rumination, or you can also say more transdiagnostically, repetitive negative thinking. And we know from research that rumination is involved in the onset and maintenance of depression. And we also hypothesize that yoga involves becoming aware of your abstract thoughts, maybe even your ruminative thoughts, but learning to direct that awareness away to more concrete experiences, like a sensation of the breath or a sensation of a stretch that you feel. So we thought that a yoga intervention could potentially reduce rumination. And in the evidence, we also found that there were a few studies already showing that a yoga intervention could reduce rumination. And we also know from research into exercise and mindfulness that these interventions have also reduced rumination. So we started with this cognitive process to investigate. Later, we moved to a few other processes that I will explain in more detail along the way. So our research addresses two important questions. The first one is, does mindful yoga reduce depression in individuals with depression? And the second question is, do cognitive variables show promise as potential mediators? So I start with our meta-analysis that has already been published. The references are at the bottom. And in this research, the question was, is hatha yoga effective in treating acute, chronic, and/or treatment-resistant depression and anxiety disorders? So we searched several different databases, and we searched until June 2018, and we searched for mood and anxiety disorders. We had many different keywords for yoga, also the more traditional Sanskrit words. We focused only on RCTs with patients with mood and anxiety disorders. So not people with elevated symptoms, but actually where there was a diagnosis of a mood or anxiety disorder. As outcome measure, we used continuous measures of severity of mood and anxiety symptoms. And we looked at the effect size, the Cohen's d, and in the analysis, we used a random effects model. So this is the first overview of the results. So what we first did is we considered for depression, all yoga interventions that versus an active control intervention. Could be many different interventions, from walking to more psychoeducation. One study even used a mindfulness intervention, or it used a massage intervention. So it's many different interventions. And what you see here is a list of these 11 randomized controlled trials that we included. And they all show their effect sizes in the graph. So if the individual effect size of the study is more left of the line, it means in favor of yoga. And if it's more right of the line, it means in favor of the control condition. So what you see is many studies found somewhat in favor of the yoga, but what we found was an effect size of minus 0.13, and this was not a significant difference. So yoga versus active control conditions, we did not find that it was in favor of the yoga intervention. We also did some analyses to assess the heterogeneity amongst included studies, and here we found that there was a large heterogeneity. This means that the results might be not as reliable. So we did some other sub-analyses. So we looked at yoga versus psychoeducation. Here we found 6 RCTs, and again, you see them in a list, and the individual effect sizes are in the graph. And then you see all the way at the bottom, this diamond shape, that's the effect size that we found, and it was minus 0.52. And here we did find a significant difference in favor of the yoga group. So compared to psychoeducation, yoga interventions indeed were more effective in reducing depression. Here we didn't find significant heterogeneity. So this means that it might be a little more reliable, the results. So next we compared yoga versus treatment as usual, all the studies that included a treatment as usual intervention. Here we found 5 randomized controlled trials. Again, they're listed in the graph and the individual effect sizes are shown, and also the diamond shape. Here we found an effect size of minus 0.64, but this was not significant. So we did not find a significant difference of yoga versus treatment as usual interventions. Here again, there was significant heterogeneity among the studies. And then finally, we considered studies that included anxiety as an outcome measure, because we did not have enough studies to conduct subgroup analyses. We only have this analysis for anxiety. So we used yoga versus all studies that used an active control group. Here we found 5 randomized controlled trials that used anxiety as an outcome measure. And again, you see them listed in a graph. Individual effect sizes are shown at the diamond shape at the bottom. We found an effect size of minus 0.09, and also here this was not significant. There also was significant heterogeneity among the studies. So here we can conclude that yoga versus active control does not seem to be more favorable in reducing anxiety. So what we concluded from our meta-analyses is that we found no significant effect for yoga versus treatment as usual and active control groups, both for the depression outcome measure and the anxiety outcome measure. But we did find a significant effect of yoga versus psychoeducation. Well, one reason that might explain this is that treatment as usual and active control groups might actually be stronger control interventions, and psychoeducation might only control for the idea that people are sitting in a group together and they have a teacher together, but it might not have that many active ingredients. It might not contain movement, such as a walking control condition, or it might not contain relaxation elements, such as massage control. And then also treatment as usual might be a particularly strong control group because it might consist of actual evidence-based interventions, such as medication or different forms of psychotherapy. So that might be a reason that explains why we did find a significant effect for the psychoeducation control group. Other important conclusions were the high heterogeneity. That means that the studies differed in many different things, and that was also due to the low methodological quality. What we found is there was oftentimes there were no blinded raters. There was no assessment carried out blind from the researchers. There was no manual that was used, so it was really hard to know actually what was happening in the study. There were no intention to treat analyses. There was no adequate description of the intervention. There was very small sample sizes. So because of this, our main conclusion actually was that we need more research, more methodological, good research in order to draw more conclusions about the effectiveness of yoga for depression. So that's where we started our project. So then we moved to our second undergraduate study, and there were 2 questions important in this study. The first one was, does mindful yoga lead to less depressed affect in moderately depressed students compared to a relaxation intervention? And then the second question was the mediation question, are these effects partly mediated by rumination? So what we did is we did 2 studies in undergraduates. It's actually 2 sub-studies. Both studies asked the same questions, but the first group that we recruited, they did not have any form of depressed affect. So what we did is we analyzed the results. We found no significant difference between yoga and the relaxation control group. But we also did some post hoc analyses, and then we found that in our moderation analyses, undergraduates with higher baseline depression, actually the yoga was more favorable compared to a relaxation intervention. So after this, we continue with the same question, but this time we recruited students that were actually showing depressed affect. So we pre-screened them. So again, due to time constraints, I will present only the latter one because it also focuses more on our target group. So we started with the method. We recruited 74 undergraduates. Most of them were female. Their mean age was 20, and they were experiencing current depressed affect. We had 2 questions to assess this, and these questions are used oftentimes in studies to screen for depressed affect. And the first one was whether they were experiencing depressed affect over the last, I think it was 2 weeks. And the second question was if they had experienced a loss of interest or pleasure over the last 2 weeks. And if they answered yes to either one of these questions, they were invited to participate in our study. So we did a baseline depression. We used the depression, anxiety, stress scales, and then especially the depression scale. And we found that at baseline, they indeed were experiencing a mild symptoms of depression. So we assigned them to either a mindful yoga intervention or a relaxation intervention. The intervention was a 30-minute intervention. And after that, we asked them to practice for 8 days, for 15 minutes a day. And after that, we had another assessment. So we used self-report measures to assess depression, anxiety, and stress. We used the MDI and the DAS. And we used the rumination, the ruminative response scale, especially the brooding scale, which is the really, what we know is very related to depression. And it's not a very constructive, reflective form of ruminating. We did assessments at baseline. We did them post-intervention, which was about 10 to 14 days after baseline. And then we did 2 months follow-up, 2 months after the post-intervention assessment. In our statistical analyses, we aggregated the depression score. We used Z-scores to do that because both measures were so correlated that we thought it's best to do that. And then we used repeated measure ANOVAs, and for our mediation question, we used the process mediation analyses. So first, a little bit about the interventions. So we started with we did a mindful yoga intervention that was consisted of different yoga postures, and the instructor was demonstrating the postures, inviting the participants to move into a posture, then closing their eyes and really develop a more mindful awareness of what was going on in their bodies or their breath. And then we also had a guided relaxation intervention where people were sitting in a chair, and they were giving a guided imagery, a visualization of a stairway leading to a place of deep relaxation. And it was really focused on relaxing deeper and deeper. So based on the work by Davidson and Kazniak, we really thought about what kind of control group do we need to use. Also with the findings in our meta-analyses, finding that it is important to compare yoga to an active intervention to see if it actually has any effect. So we finally chose a relaxation control group because with this intervention, we could not only control for being in a group together, having a teacher together, but also for potential relaxation effects of yoga. And then also in the relaxation intervention, we really tried for the instructor to refrain from any mindfulness cues. So by this, we also hoped that the mindfulness intervention would have this of the mindful yoga intervention would have this mindfulness aspect specifically. All right. So I'll move to the results. So what you see here is a bar graph. It shows the different scores of the depression outcome measure. So what you see is if the bar graph is higher, it means that there was a more difference in depressed affect. And the blue bars represent the mindful yoga and the green bars represent the guided relaxation group. And then on the left, you see the difference from baseline to post-intervention. And then on the right, you see the difference from baseline to 2 months follow-up. And as you can see in the graph, post-intervention, there was no significant difference between the group. There was very, very little change in both groups. But at follow-up, what we found is there was a reduction of depressed affect in the mindful yoga group, and there was actually more depressed affect in the guided relaxation group. So we found a significant difference here in favor of the mindful yoga group, with the mindful yoga group showing a larger reduction in depressed affect, but only at follow-up. And then we did mediation analysis to see if this was also due to changes in rumination, but we did not find any indication of mediation of rumination. As you can see, post-intervention, the confidence interval contains 0, and also at follow-up, the confidence interval of the indirect affect contains 0. So that means that we did not find any indication of mediation by rumination. So to conclude from these studies, we found that mindful yoga may have some promise for young adults with symptoms of depression, but we did not find any indication of mediation by rumination. So from this, we started thinking maybe other mechanisms are important, and we need to look for other potential mediators. So this brought us to the mechanism of fear of emotion. Fear of emotion is defined as the fear of losing control of one's emotions and also one's reaction to these emotions. And we know that this fear of emotion is associated with maladaptive coping strategies, such as suppression or avoidance. And these coping strategies are associated with symptoms of depression and with negative affect. So we thought maybe this is an interesting mechanism involved in depression. And then also we thought that theoretically, yoga might be able to change this fear of emotions. Because in yoga training, the instructions involve this development of a non-judgmental awareness of emotions that are going on, and also of cognitions that are going on, and developing this more accepting attitude towards emotions, and at the same time also offering some sort of exposure to these emotions. When emotions come up, just be with them and notice them, and then maybe also move your awareness to something else, like your breath. So we hypothesized that yoga could actually change the fear of emotions. So this is what we studied in our pilot study. This was a study where we started working with our patient group. We started working with the chronically depressed patients. Later, we moved to the young women with depression that I will explain later. But the department that I work in, we have a lot of people that are chronically depressed or chronically experiencing anxiety disorders. And with chronically, we mean more than 2 years. So in our pilot study, we had 2 important research questions. The first one is, does mindful yoga lead to a greater reduction of negative affect in chronically depressed patients? And again, a mediation question, are these effects partly related to changes in worry and rumination? We were not ready to give that up yet. So we studied it again, and of fear of emotions. Yeah, I think this is, we also did a lot of qualitative studies in this pilot study, because we wanted to know, is the intervention that we develop, is it feasible? Is it acceptable for patients? So I will not present that due to time constraints, but the article has already been published, and in the publication you can also find a lot of the qualitative assessments. And based on these input from our patients, we also updated the yoga intervention and continued to work with it. So our method was, it was an open label pilot study. And we studied the effects of a 9-week manualized mindful yoga intervention. So we first developed the intervention. We developed a manual. We also developed a home practice manual that I will come back to later. We included 12 patients, again, more women than men. Their mean age was 49 years, and they all had chronic mood disorders. We found 10 of them were completers of the intervention eventually. Their mean illness duration was 11 years. So you can imagine this was a very chronic group. And their mean duration of current treatment was already 5 years. So we used, again, self-report measures. We assessed depression, anxiety, and stress. Again, with the DAS, depression, anxiety, and stress skills. We assessed worry using the Penn State Worry Questionnaire. Rumination, again, using the brooding scale of the ruminative response scale. And then we used fear of negative emotions, the affect control scale, that uses different types of emotions. So fear of emotions of depression, of anger, of anxiety, and also positive emotions. And we did assessments at baseline. We did them post-intervention, which was about 10, 12 weeks after baseline. And then we did it a follow-up assessment 4 months later. So this time we developed a longer intervention. So in our previous study, we used a short intervention, but this time we used a 9-week group training with 2.5-hour weekly sessions. And we designed the training to specifically focus on these processes that we hypothesized that yoga could help with. So there was a lot of room for developing this mindful awareness, for developing more awareness of bodily sensations, of emotions, of thoughts. There was this training of awareness. There was a lot of room for listening to your body, listening to your boundaries, developing a more accepting, self-compassionate attitude. So that was all part of the intervention. We put yoga postures in the intervention, but also breathing practices, meditation practices of traditional hatha yoga. And in this 2.5 intervention, there were also some group sharing exercises where the group was sharing their experiences and we're discussing the homework and questions they had because of the homework. So that was what we did in the intervention. We invited participants to practice at home for about 30 to 45 minutes per day. We asked them to do that. And what we found is that quite a lot of them were actually not practicing that much, but were practicing quite often, at least 3 times a week. So we offered them little practice videos, and we offered them a paper manual where they could register what they were noticing while they were practicing, and that they can use that in the group discussions. So again, here you see a bar graph, but this time there was no control group, so both bars represent the yoga group, the 10 participants that completed the intervention. And in this bar graph, you see the negative affect, the reduction of negative affect. Again, these bars represent the different scores. So a higher bar is a higher reduction of negative affect. So in this study, I will not present p-values because it was such a small study, and we did not really present it as a hypothesis testing study, but more as a study to gain more information about potential mechanisms and to help us see if these were mechanisms that we were actually proceeding in other studies. But you can see that there was a decrease in negative affect, both from baseline to post-intervention, which is the left bar, but also from baseline to the follow-up 4 months later, which is the bar on the right. Then for rumination and worry, again, you see the bar graphs. Also here, it represents different scores. Larger bars means a larger decrease of rumination and worry. What you can see here for both, we did not find very much change at post-intervention. And interestingly, for rumination, we did find a larger decrease of rumination at follow-up. And for worry, you can see that we found some change, but it was not a lot of change. And then finally, we assessed the fear of emotion. So post-intervention, again, here you see the bar graph. And on the left, from baseline to post-intervention, you can see that we found an increased acceptance of negative emotions. So here, a larger bar means more accepting of negative emotions. Or, oh, sorry, I thought I heard someone. I think it's okay. All right. So here, a larger bar actually means more reduction of fear of emotion. And at follow-up, you can see that there was some change, but it wasn't as much change as we found from baseline to post-intervention. So for this fear of emotions, we actually found that the effect did not really last very long. So to conclude, what we found is that mindful yoga has promise for chronically depressed patients in reducing negative affects. And we did find that rumination this time shows a little bit of promise as a mediator, but only at follow-up. So after this, we started to think about other potential mediating mechanisms. We looked at self-compassion, intolerance of uncertainty, body awareness, and mindfulness. And I will explain these processes in more detail now that I will be presenting our last study, which is our randomized controlled trial. So in this randomized controlled trial, we had, again, 2 research questions. The first one is, does mindful yoga lead to greater reductions in depression symptoms when added to treatment as usual compared to treatment as usual alone in young women with depression? And then we asked the mediation question, are these effects partially mediated by reduced repetitive negative thinking, increased self-compassion, decreased intolerance of uncertainty, increased body awareness, and increased mindfulness? So with this study, we moved away from the chronic patients to the young women with depression. One reason for this is that we know that depression is very common in young women. They are at high risk of developing depression. We also thought that yoga might be an interesting intervention for this group. So, but that also was a little bit pragmatic because there was a call for a fund that was focusing on young women with depression. And then we thought, well, we have the yoga, we have the young women with depression. Let's write for this fund, and we were granted that fund. So it was also a little bit of a pragmatic reason because of financial reasons. So here I introduced 3 other mediating mechanisms, and the first one is self-compassion, or the opposite, self-criticism. And we know from research that self-criticism is involved in the onset and in the maintenance of depression. And again, as I explained in the fear of emotion mechanism already, the instructions of mindful yoga involve much of this developing of a non-judgmental awareness of whatever is going on in your body and your mind, and developing a more accepting, compassionate attitude towards the body or towards yourself during the physical postures. So we thought that theoretically, mindful yoga might enhance self-compassion. And we also found that in the evidence that yoga interventions were shown to increase self-compassion that was in healthy adults or people with eating disorders. And we also know that mindfulness interventions increase self-compassion. So we thought maybe the mindful yoga intervention as well. Then the other mechanism that we considered was intolerance of uncertainty, which is negative beliefs about uncertainty and also about the implications of uncertainty. and a tendency to react negatively to uncertain situations and events. Again, we hypothesized that mindful yoga might change these intolerance of uncertainty because it includes, again, the practices to develop the non-judgmental awareness, specifically also of difficult emotions and cognitions. And this is a relatively new mechanism, especially in depression. So no studies have examined the effects of yoga on intolerance of uncertainty, but yoga interventions have been found to increase this non-judgmental awareness. And also we found that mindfulness interventions may reduce anxiety via the change of intolerance of uncertainty. So we hypothesized that maybe this might also be the case for mindful yoga. And then finally, the mechanism that we focused on is body awareness, which is the ability to recognize bodily signals, but also to respond to them adequately. And in this adequately is also the idea of having this non-judgmental awareness, observation of the signals, instead of what we also see, for instance, in panic disorder, where people ruminate a lot about their body's signals. So it is both the awareness and also the responding with an openness. Well, of course, we thought that theoretically mindful yoga might change body awareness, because the interventions include very much becoming aware of everything that's going on inside your body, becoming aware of sensations, of stretch, of how your body moves, where your body's limitations are. So we thought theoretically yoga interventions could enhance body awareness. And indeed, it is found that yoga practitioners report more body awareness, and also that yoga interventions can increase body awareness in healthy adults. And then our final mechanism is mindfulness that we focused on, which is, of course, this focusing on the immediate experience, again, with this quality of curiosity, openness, and acceptance. We hypothesized, of course, that mindful yoga would also be working through developing more mindfulness, as this is a big part of the instructions. And we also found that indeed, from the evidence, yoga interventions could enhance mindfulness. So we added these mechanisms to our larger randomized controlled trial. So this is the design of our study. So finally, we included 171 young women with depression, and they were randomized to either treatment as usual, or they were receiving treatment as usual plus the mindful yoga intervention. And as you can see, we had assessments post-intervention, and for the treatment as usual group, it was the same amount of weeks. And then we had a 6-month follow-up, 6 months after the post-intervention assessment, and 12-month follow-up. So our participants were 171 young women, and they were all currently in treatment. I will explain the treatment in more detail soon. The inclusion criteria were a primary diagnosis of major depressive disorder and an age between 18 and 34 years, because we know that this is the age where the largest risk of developing a depressive disorder for women is. We also had a few exclusion criteria, which were bipolar disorder, substance dependence, current psychotic symptoms, and active suicidality, and a current regular yoga practice. We defined it as an average of 30 minutes or more per week over the past 6 months. So we really wanted to recruit people that were not already doing yoga. Again, we did a 9-week yoga intervention that was based on the intervention that we studied in our pilot study. But this time we used 1.5 hour weekly sessions. Also because of the feedback of our pilot participants, and a lot of the group sharing exercises were cut out. So it was mainly physical postures, breathing practices, meditation practices, and a shorts sharing exercises. We offered an online module. So this time we didn't use an actual paper manual, but we developed an online module that participants could access, in which they could find more practice videos. They find registration assignments where they could write down what they noticed while practicing. And also there was psychoeducation about yoga, about the processes of yoga, about these processes, cognitive processes in depression. So that was also in the online module. And then it was a study in a clinical setting. It was at a couple of different clinics in the northern part of the Netherlands. And the treatment as usual was given according to the Dutch treatment guidelines for depression. We also assessed the actual treatment that patients received at the end from their medical files. And I will come back to that later when I'll tell more about treatment as usual. But most often it consisted of a psychological treatment, most often cognitive behavioral therapy, and also antidepressant treatment. So our primary outcome measures were, of course, symptoms of depression. We had an independent rater who rated it using the Hamilton Depression Rating Scale, and we also used self-report using the depression scale of the DAS again. And then at the very end, we also did a diagnostic interview assessing whether or not the participants were still having a diagnosis of major depressive disorder. And then our mediators that I introduced before were repetitive negative thinking. We used the preservative thinking questionnaire for this. Negative self-evaluation or self-compassion. We used self-compassion scale. Intolerance of uncertainty, we used intolerance of uncertainty scale, the short form. And then for body awareness, we used the scale of body connection and 3 additional items of the multidimensional assessment of interoceptive awareness scale to assess the trust in the body. And then finally, we used mindfulness, the 5-facet mindfulness questionnaire. Our statistical analyses were based on intention to treat. We also did per protocol analyses, including only participants who attended at least half of the mindful yoga sessions, which were 5 out of 9. Because of missing data, we used multiple imputation. We imputed 5 data sets that we used for the analyses. And then we used repeated measure ANOVAs for the primary hypotheses and the mediation hypotheses. We used the process macro using bootstrap and regression models. All right, so I move to results. Again, here you see a graph. It's a bar graph that is again showing the different scores. The blue bars represent the yoga group, and the green bars represent the group that was only receiving treatment as usual. And again, here the different scores. So a larger bar represents more reduction of symptoms of depression. And what we found in our analyses, and what you can also see in the graph, is there was a significant effect for time. So as you can see, over time, there is a decrease in symptoms for both groups, but we didn't find an interaction between time and groups. So we didn't find that yoga was more effective in reducing depression compared to treatment as usual alone. So here you see the results for clinician-rated depression. Again, it's a bar graph. On the left, you see the scores from the baseline to the post-intervention. In the middle, from baseline to 6 months, and all the way on the right, from baseline to 12 months. Blue, again, is the yoga group, and green is the control group. And again, here, what you see is there's a significant effect for time. As you see, for both groups, there is an increase in different scores, so a decrease of the depression symptoms. But also here, we did not find an interaction between time and group, so no favor of adding the yoga to treatment as usual compared to treatment as usual alone. And then finally, we looked at the diagnosis of depression. this was only a 12-month follow-up. So at the start, at baseline, everybody had a diagnosis, and a 12-month follow-up, we did a diagnostic interview again. So here you also see a bar graph, but this time the bars represent the amount of patients that were still having a diagnosis of depression. So this time a smaller bar is better. So blue again is the yoga group, and green is the treatment as usual group. And here you can see that in the yoga group, there were fewer people who were still having a diagnosis of depression. But in our analyses, we did not find this a significant group difference. So there was no significant group difference between yoga and the control group. So we did mediation analyses for all of these 3 outcome measures and all of our 5 mediators. I will not show all of these analyses, but I will just go over the findings, and it is that we did not find any indication of mediation for the potential mediators for any of these 3 primary outcome measures. And the mediators were repetitive negative thinking, negative self-evaluation, intolerance of uncertainty, body awareness, and mindfulness. What we only found is that there was a change in favor of the yoga group for self-compassion and body awareness. So we did find that the yoga intervention was doing something for these mechanisms. There was no group difference on the other mediators, but these changes were not mediating any changes on the depression outcomes. All right, so to conclude from this study, what we found is adding mindful yoga to treatment as usual, it did not lead to a significant group difference in reduction of symptoms of depression, not for clinician rated, not for self-report. And it also did not lead to fewer diagnoses of depression at 12 months follow-up. We did not find indication of mediation for any of the potential mediators. And 2 important reasons are there for these findings. And the first one is the suboptimal use of the intervention. So what we found is in a pilot study, participants practiced a lot. So most of them practiced at least 3 times a week. In this study, we actually found the opposite. So we found that the online module was used very, very little. And also in this study, we asked participants to practice 30 to 45 minutes a day, 6 days a week. But I think there was 1 or 2% who actually did that. So most of these participants did not practice more than 1 time a week. So they only had a weekly intervention, maybe did a little bit of practice, but not that much. So we can just conclude that there was suboptimal use of the intervention. And the other thing that is important is that we had a strong control group. I already explained that the treatment as usual was given according to the Dutch guidelines. We found that all of these participants were receiving quite a full scale of treatment as usual. So most of them were having at least 2 interventions, both a psychological intervention or medication or some other intervention like a nursing treatment. So already the treatment as usual was very strong. So maybe adding the yoga, there was not possible to add very much. Or, and then I come back to the first issue, they were already very busy with their treatment as usual, and they might not have had the time or the energy to dedicate to the yoga intervention. So maybe that's why we did not find significant group difference in favor of the yoga group. So a few strengths and limitations of our randomized controlled trial is that it was a methodological strong study. We have a large sample size, we have low attrition, we had adequate randomization, reliable rater blinding. We assessed also the rater blinding, and she was not correct in less than 50% of cases, so that was good. And we had a relatively long follow-up of a year. And then we also had a good assessment of treatment as usual. We had the patient's medical files. We can actually see what they were receiving. We did not find group differences in the treatment as usual. But we also had limitations. One is that I already explained. They both received treatment as usual. So maybe they had little time or energy for the mindful yoga. And there was a lot of non-compliance regarding the practice time. And then also there's a limited generalizability for these results. Of course, only young women with major depressive disorder. You can imagine that maybe for other groups, or maybe for the chronic group, it might be a better fit. We also thought that maybe it might be a better fit as a prevention of relapse of depression when they have already finished treatment, because then maybe they have more time or energy to dedicate to the practices, and it might lead to more to less relapse or less time to relapse. But that is for a new project, maybe one day. All right, so the overall conclusions of our studies is that mindful yoga shows some promise for different groups with depression, but the results are not very overwhelming. Potentially more for chronically depressed patients and young adults with a relatively low, like mild form of depression. And the role of mediators remains still unclear, but self-compassion and body awareness, especially from the randomized controlled trial, they appear to be most promising. So yoga intervention appears to work mostly on those mechanisms. All right, so thank you very much for listening, and I think we are moving to the question and discussion part.
Yes, thank you so much, Nina, for your presentation. It's really, really interesting, especially the conclusions. Less promising as one would have expected. And we are getting more and more research results like that over the last few years. So we are really interested in why that might be the reason, and discuss that further with some friends here who are probably also finding similar results.
Yeah.
Let's,
Can I stop sharing?
Yes, please. Yeah.
Then I can also see.
But meticulous research is important to be able to find whether it's efficient or not, or in what areas this type of intervention is efficient or not. So let's discuss some questions, and we would start with Annie Bloch.
Okay, well, mindful yoga is a subset of yoga, and yoga is a subset of embodied practice, okay? And yesterday I watched a video on TV where they were dealing with sport as a way to deal with mental health problems, not depression per se. And what was really interesting is to say that there is a very important ingredient, which is pleasure. And if you don't have pleasure, you cannot sustain anything. And something which is very well known in sitting practice, of course. They explained, it was very interesting. I cannot get into detail, but they said that if you get into that, there's a 5 weeks period where things are kind of unpleasant. But if you stick with it, after 4 weeks, the pleasure ingredient comes in. And my own experience of yoga, I hated it because I never got to the point of enjoying it. And my question is, and I know depressive people, they won't do anything, but still you got them to do yoga. So you might get them to do something. My question is, why not dance as a practice without even talking about mindfulness, just dancing, you know? Especially collective dancing, because lately I found something which is really extraordinary, which is the Azul School of, it's a path of conscious movement, you see, and comparing yoga, even mindful yoga, to movement practices without even talking about mindfulness, you know, having this to compare with, as opposed to cognitive therapies and things like that. I think I would be interested in learning about that. I will put you some information in the chat, about the school I'm talking about, because it's easier to find pleasure in dancing, and it's easier also to find interaction, and that's also very important. Well, that's about it.
Yeah, well, thank you very much. This is a wonderful comment and a wonderful idea, especially what you explain about the sports research and how the pleasure element's very important. I was just wondering, we assessed many different things, but we did not ask the participants how enjoyable they found the intervention. We did ask them if they find the intervention useful, if it was successful at reducing their depressive symptoms, but for our next study, I will absolutely keep this in mind. And then also, we did find that I think it was about 25% that did not complete the intervention, or it was like 22%. They drop out, and usually they drop out soon. So I was also the yoga teacher in this study, so I saw it happening, that they were being confronted with their thoughts or with how depressed they were, and they did not want to continue because of that. And indeed, if they stick with it, they might have been able to experience some benefit. Although we did do analyses between completers, non-completers, and how successful or how satisfied they were, and try to see if that was important in the outcomes, and we didn't find any difference because of that. Maybe if we enjoyed
this was a show on French TV, which might be available in French for a few days. So for those
my
who are
French
interested,
is not that good, but I will see if I can find some research.
Yeah,
I really like the idea.
I'll put my email, and see if some people are interested after this talk. I will send them because it's really fascinating. I was taking notes like that,
Yeah, and then also I really liked your idea about dance. I love to dance. I'm also a yoga dance teacher, so it's really something down my lane. Maybe for next project, what I can say about that now is that studying mindful yoga intervention already was very new in the Netherlands, and it's not easy to find money and to be able to fund a study. I think dance is even more innovative and experimental, so maybe one day, but not in this study yet.
Thank you. This was an interesting comment, and if you can share the reference to the show, Andy, that would be wonderful.
Yeah, thank you very much.
And Murillo.
Hello. Thanks. I was very impressed by the quality of how you did one study after the other, and the questions made sense, the methodology made sense. So thanks for sharing. A couple of questions. One is a clarification one. How should I interpret the difference score that you presented? How big is good enough a change to have a positive impact in the mental health or the quality of life of these patients? You didn't help us interpret what the difference score means, or how. Yeah.
In which study do you refer to? Do you mean all of them?
Well, all of them, because you showed different score in all of them, and I don't know how to interpret these numbers. Yeah,
very good question. So I think what I can speak to in a pilot study is, because this is a chronic group, that even a small difference for these people already is a big difference, because they have these depression symptoms for 11 years. So in this study, what we thought was that there was a lot of clinical difference. In the randomized controlled trial, we also assessed the mean clinical difference. So is it clinically meaningful, what we found? And what we found is that, I have to remember it correctly, I think we met the difference between the groups was about half of the clinical difference. So you can say that there was some clinical importance in reducing symptoms of depression, but it was not a very important clinical difference.
Okay, if no one wants to ask, I'll ask a second question. Does anyone want to jump in?
Please go on.
Okay, well, I have several. You said you did some interviews with, I'm focusing on the RCT. You said you did some interviews with the patients, with the participants to try. What did you learn from the interviews? I'm especially frustrated that you had such a large, that you at the end you suggested that they engaged with the yoga classes very little. You said something like most of them did less than one class per week, something along those lines. Because if they didn't engage with the intervention, then it's difficult to know what exactly we're looking at when we see the results. Then, so I would have liked to have seen a distribution of how much they used the intervention. Is it that, some of them didn't do a single class, some of them did all of the classes? What is the distribution of this? So maybe you could comment on that. And did you include, if there is enough variation in this, did you include the intensity in which they used as a covariate in the models to see if that could help tease out the effect?
Yeah, very good, very interesting questions. Thank you. I have information on this. I have to do it from my head right now. There were 2 people that did not take a single class that I know. And then we saw that about 25% dropped out. So that means that they did not complete 5 classes or more. So there was 75% that took at least 5 classes. The mean classes of the people that completed was about 7 classes. And then what we also saw was that about half of the participants were practicing at least once a week. And at least once a week already is not very much. So there was at least half of the participants that were not practicing at all or very much. And we saw that as long as the study progressed, these numbers became lower and lower. So at the end, I think there was only 30% of participants still continuing to practice at least once a week. We asked them to self-report their practice, but we also know that that's not always very reliable. So we also had a tracking system to track and see if they actually used the online module. We couldn't track like how many time they spent on it. That would have been even better. But we could track how many sessions they at least opened, how many sessions they completed. And yes, we did analyses to see if that was an important factor, but we didn't find it. But that was also because a lot of participants did not use that module at all. We had 17 participants that never opened it, not a single session of the 88 participants. I think we had like 3 or 4 participants that completed the entire module, and the rest stranded somewhere in between, and more of them stranded after 2 or 3 sessions than after 6 or 7 sessions. So again, it was difficult to find a reliable assessment of the actual amount of practice.
Yeah. Thanks for these comments. I see Aude has her hand up, so I'll shut up for a minute.
We can come back to you, Murillo, definitely. So, Aude.
Hello, Nina, and thank you so much for such a large body of work. That's very impressive, and it's a wonderful subject. I've been a yoga practitioner for decades myself, so thank you. I have quite a bunch of questions, and I think the first question I will ask is partially answered, because I was wondering what people are doing between those follow-ups in your RCT study. So you have 6 months and 12 months. I assume you're going to say nobody practiced, but I'm just curious if you have any idea of what happened in between.
Yeah, we did assess. You mean like regarding the amount of practice, right? Or do you also mean whether they finished the treatment as usual, or
all of it, I suppose, for
yeah,
both.
yeah, we assessed everything. It will be in a paper that is about to be published soon. So we did find that the amount of practice became less and less over the amount of study. And I think, I don't know the exact numbers, but I think it reduced to like maybe only 30 or 20% that was still practicing at least once a week. We found that quite a few people were finishing their treatment as usual. We made no restrictions to the clinicians. They could finish the treatment if this person was finished, but there was no difference between the groups. We also checked that. I think those are the most important things about your questions, right?
Yeah, and I was curious because maybe I thought I saw the graph changing at 6 month and 12 month, and I was wondering if you had any potential explanations for that.
Do you mean the self-report question, right?
I assume so. I assume so.
I think so, because that was the questionnaire that we saw most change on. If we analyzed, if we look at specifically the change from baseline to follow-up, we did see a larger change in the yoga group in self-reported symptoms of depression compared to the control group. Yeah, that's true. But in the analyses, it was not significant. But coming back to the question of Murillo, it might be clinically important for this group of people. They might have, for individuals, it might have been important.
Thank you.
Thank you, Odd. So any other question from Mar or Sonia before we turn back to Murillo maybe, or Maria, Benjamin? Okay, so Murillo, and if you have any question, just let me know.
Okay. So listening to your talk is bittersweet, because I was super excited with the quality of what you did, and you kept throwing at us non-significant results. And I wonder, so given, this is a short talk, so you have access to all the process and all the raw data and so on. What do you think is behind this? Is there a methodological issue? Is it the fact that people didn't engage, and maybe that's the essential point? Or is it maybe that yoga is not really doing much for this particular cohort that you studied? Where do you think might be I know we don't know for sure, right? But what do you think is the reason behind all these insignificant results?
Yeah. Well, I can look at it from many different perspectives that I will try to explain. Well, of course, we cannot rule out that yoga maybe doesn't do very much as a treatment for depression. That's the first thing. I mean, we started this project hoping that it would enhance treatment, but maybe we should look at other things like sports or dance. So this is not something that we can rule out based on our study. I do see, I was also the yoga teacher, so can also answer this from a more clinical perspective. And what I saw as a teacher was that about 25% of people, they don't like it. So coming back to the comment that Annie made, they will drop out. They don't like it, they don't do it. Then there's 50% that likes it a little bit, not that much, and they don't do very much with it. And then there's 25% that actually really not only likes it, but gets the point of developing more mindful awareness, more self-compassion, and how that might help them with their depression. But we look at means in research, so these results, they are maybe lost, I don't know. So I think that is there is some element about how much they liked it, and also because it might be, and that this is what we took from the qualitative interviews, it is also a challenging treatment when you're a young woman and you're depressed, because you are forced to sit still and move in a group of women where you might feel very self-conscious and very awkward, and you're confronted with your thoughts that are not very happy thoughts. So what we learned from qualitatively assessing these experiences, that was difficult for a lot of women. And some stick with it, and then they finally also learn something from it. But a lot of them don't stick with it. They either don't practice because they don't want to sit still, or they just drop out of the intervention. So I think this is also an important aspect. And also, this is why I was really interested also in the qualitative views, because then we ask the women, what did it actually do for you? And then it comes to things that we didn't measure or were not able to measure, because most of them said it was a moment of relaxation. It made them feel more relaxed. It also helped them to find a moment of being more relaxed during the day. So it might not necessarily help them with their depression, but if you talk about clinically meaningful results, this might be important for someone who is never feeling very relaxed, or who is always running through their days and now being able to find a moment to relax. So that's another aspect of our findings. I don't know if this sort of answers your question. I mean, it's all very speculative.
Thank you, Murillo. Aude, you have another one, yeah?
I have many others.
Oh, no problem.
Very nice.
Yeah, I love the subject. So one of the things that I was also interested in knowing, and this is getting much more specific, I assume you were talking about the manual, is what type of asana you used. And I'll give you the background from which I come from, is that, I've been practicing Iyengar yoga for many years, even though in a non-dogmatic way, if you understand the message behind.
I do, yeah.
Yeah, I'm sure. And so because as you know, in Iyengar yoga, the type of asana we use for which purpose and the sequence. And so I was curious if that had been in your thinking.
Yeah, from there's many different ways to approach a manual, and one of them is from traditional yoga. There's this idea that certain postures are good for certain conditions. So for instance, it's recommended that for depression you use a lot of back bending in order to open this area, which would be good for depression. But there's no research supporting that claim. So what we try to do is to make it more into an intervention that was targeting on these mechanisms that are supported by research. So a few things that are important in our choice of asana. The first one is nobody had any yoga experience, so it's basically a beginner yoga class. And because it's all women that feel depressed and are probably very self-critical and very not so comfortable with their bodies, we only used asana that people could do, that they could leave the room with at least an idea, okay, I was able to perform these postures. So in the postures, there were a lot of options. There was a lot of use of props. There was a lot of offering, saying, stop where your body tells you to stop. I think the most difficult, if you can say difficult, each posture is difficult for different people, but the most advanced posture maybe was a triangle or a half moon, and the half moon using a lot of support. It started with easier postures, and then it built it to a little more complicated postures, but it was repeated during the sessions, and then something was added, and we understood from the participants that they really liked that. So there was some sort of structure. There was something that they thought, oh, we know this, And then it was built from that. Yeah. And then also we use quite a few exercises that had movement in it. You can imagine like a cow or like a moving side bend. Also a little bit because of what Annie said, because also this movement element is found in research to be important.
Thank you.
You said you have some more questions. I wonder, Nina, if you would be willing to spend another 5-7 minutes, so not finishing it.
Yes, I really like talking about the subject, and I really enjoy the questions and discussion. So sure.
Yes, so maybe 2 more questions, one from Murillo and one from Aude still. And I would also like to make a comment towards the end, maybe. So Murillo. Okay.
Slightly worried about asking this question, and it's not to I'll just ask you. Okay, given that we're in the mind and life, did the inactive approach figure in your study in any way? Because from the results and methodology you showed, I have the impression that we could frame this in a traditional cognitivist way. And I'm wondering whether the way you framed what's going on, your theoretical idea about why yoga should work and so on, and in your interpretation of the results, do you use an inactive approach as your theoretical perspective or not?
Can you maybe explain a little bit what you mean with inactive approach?
Okay. I thought this was a given, but maybe I'm okay. So then this is not the right question to ask. So can I ask another question then instead of, no, okay, I'll just give up my time because we're running out of time, and Aude can ask her question.
No, please ask.
Sorry, yes, Gabor, I think it's a great question.
Well, yeah, but if I think the answer is no, right? The answer is no. So it's.
Personally, I think that that the approach Nina applied was more related to classical mindfulness and yoga interventions, and not necessarily having this, I would say, more recent rediscovery of Francisco Varela's an active approach developed in the Embodied Mind book, and more recent Mind and Life Europe events. But that's not an issue or not a problem, I would say, not an expectation. It's just simply what trend you belong to and what approaches or what methodologies you want to apply. And this question is valid, I think, Murillo, and we may come back to that, and we may explore that in the coming months and years. And maybe Nina would be happy to take part in some of our events with regards to exploring and studying an action and participatory sense making, and seeing whether that approach could help developing whatever, mindfulness or mindful yoga or other interventions further. Because one of the outcomes of these research is not just Nina's research, but also we heard from Willem Kuyken and from Thorsten Bahnhofer earlier this year that they found very similar results, that those interventions that they applied in their research did not really add a lot to those people suffering or having mental health problems. And the findings were kind of disappointing in that sense. And what's the reason? That's the big question. That's the next question, I think, for these researchers, for us here, and for everyone. Willem Kuyken's response or answer to that question was that we can't really separate these interventions from the wider social context or cultural context or the environment around us. So one very specific intervention would not necessarily lead to significant change or improvement of these conditions, because the wider social context and the environment is still there, is still affecting these people's lives. And one tiny little thing may not lead to radical change and radical improvement in their conditions. So we would need to address the wider set of issues and the wider context of potential causes of these issues, and that may lead to maybe an active or another maybe social context related research or theory or even
You mean
intervention.
taking it more to a societal perspective instead of, because this is a very individualized approach.
Sure.
We offer individual skills that we hope that their depression will be reduced. But I completely agree that there's so much more than just teaching an individual these skills.
Yeah, and that's where Annie's comment about pleasure was so significant. If something
and
is not
interaction
enjoyable,
and connection and
yeah. So enjoyment and pleasure should somehow be part of these interventions in the future. I agree.
Yeah.
Or yours is the final one.
Oh, I would love to, but I think Mar has her hand and she hasn't asked any question.
Yes, Mar, please. Sorry, I couldn't see your hand.
Oh yeah, I see a hand, but it's in the background. Yeah.
Now I can see it.
Thank you so much. I was thinking when you were asking that question, why this hasn't worked, and I'm thinking how maybe to make these interventions easier for patients that have depression, or even thinking about even my parents, for example, that they have no knowledge about yoga, or even preconceived ideas that yoga is this, I don't know, they have like a negative bias towards it. And even naming it with a different name, like I'm just thinking, for example, about my parents here, to put an example of just, if I tell them to do a relaxation class or like a stretching class, I think they would be even more like up for it, and they would like get more like relaxed in it. And then also maybe trying these approaches in centers where for the centers for depression or these kind of things, where they don't have to do these things, which is quite difficult when one is experiencing depression, to like get yourself to do it every day. But if you have a class in the same space where you are, maybe that would be easier for them.
Yeah, I can totally see your point, and I think that's really important. We saw in our participants that a lot of them had a very prejudiced idea about what yoga was. So in order to recruit them, we had to really explain how this intervention was. They thought that it was only for skinny, very flexible women, and that they didn't fit in it. So we were able to explain to them the nature of our intervention. And eventually we recruited 171 women. So I think most of them were able to overcome their ideas that they had because of yoga. And we specifically wanted to make it part of the treatment as usual. So the groups were given in the clinics, they were actually receiving their treatment. And we also wanted to have their therapist involved. So if they had difficulty practicing, they could discuss it with, we were encouraged them to discuss it with their therapist. So yeah, it's all very important considerations.
Thank you, Nina.
So yours is the final question still.
Okay, thank you. So I think for the final question, I'll just read your meta-analysis because it's a follow-up on that. It's talking about which active control group was significant versus the yoga. And because I share the disappointment somehow of the results, I recently listened to Norm Farb on the Mind and Life podcast, and he was mentioning studies that I haven't had time to read yet. But he was mentioning that I think it was the sensory motor areas being turned off that were predictive of long-term depression. And so if you think about that, it's kind of in a way, even hard to still believe, you know, those results, not even going to a different approach. Yeah, so I guess it was more a statement than a question at this point.
Yeah, but I really like your statement. Thank you. That's very interesting and important to consider. And I think there's a lot that we still don't know. Sometimes research brings up more questions than answers, right? So maybe that's a good concluding remark.
Yes, it's fascinating in the sense that we have lots of open questions to discuss and to work on, to deal with still. And
yeah, so
rather good.
Thank you very much for your interest, for your questions, and it's really interesting and enjoyable to talk like this.
And thank you, Nina, for your work and for your strive for truth with your research. Instead of wanting to prove a point, you are presenting your results as a good researcher should do. So thank you so much. And it inspired a really great discussion. Thank you all for contributing to that. Annie, Rio, Aude, Maria, everyone in the chat. And I would just like to hand the floor back to Johanna.
Thank you again, Nina. So I just wanted to really briefly announce our last public online talk of 2022, to which you're all warmly invited. So it'll take place next Wednesday, December 14th at 6 p.m., as most of our talks are. And we'll have the pleasure of welcoming Martine Batchelor, whom I imagine many of you know or have heard of. She's a very well-known Buddhist teacher and writer, a former nun in the Korean tradition. And she'll be giving a really vast talk on the subject of the art of meditative listening and speaking while standing at the edge. So it'll be a similar format with about a 45-minute to an hour-long talk, and then time for discussion and questions like we've had this evening. So thanks again, everyone, for joining, and have a good evening. Hope to see you next week.
Thank you all.
Thank you.
Thank you. Bye-bye.